This is the second part of our examination. So now the doctor is going to explain to me or to the patient what kind of physical examination he wants to do and why. But before that, the patient has a question to ask the doctor, and this question is, do you think I have a sexually transmitted disease?
From your history, I don't think about you got the sexual transmitted disease, because most of the people who infect this disease may have the vaginal discharge, like a pus or something like that.
Okay, so the doctor is saying he doesn't think the patient has a STD from the patient's history, and also no pus discharge, pus, P-U-S. So now, doctor, can you tell me what kind of physical examination you want to do and why? Imagine, for example, the patient may want to ask you some questions while you're examining her. Why are you doing this, for example?
Okay, first of all, the patient problem is amenorrhea, or missed period for 3 months. The first thing that I think is her get the pregnancy. So I have to check the sign of the pregnancy while I'm taking the physical examination, especially the pelvic examination. They may have the softening of tissue from the high blood flow, and the second cause of the amenorrhea is that may be mostly from the she don't have an ovulation, because from her characteristic of the menstruation. So I will find out what is how many of her weight, and will calculate to be we call the BMI, body mass index, to get to see her have the obesity, and I will check her vision, because some disease such as the tumor disease in brain, we call the pituitary disease, may produce some kind of hormone that can interfere the menstruation.
Yeah. So the doctor said he is going to order a urine test to check for pregnancy while he is physically examining the patient. Can I ask you, doctor, how long the pregnancy test will take? How soon can we have the results?
Usually the urinary plaque test, we can show the result positive when you have the missed period about 1 month, but it depends on your testing, because some testing can detect this hormone in the higher level. So that means the positive from testing may be last more than 1 month.
There are 2 points I want to make here. The first is that the doctor is saying we usually need at least 1 month after the last period before we can detect pregnancy. And the other point is the urine test for pregnancy will only take around 30 minutes. The doctor mentioned about softened tissue, which I didn't quite understand. Perhaps he could explain that in more detail.
Okay, normally when a woman get the pregnancy, they have a lot of blood supply in her genital organ or genital area, so that may make and the additional the effect, the hormonal effect that may make her vaginal or genital organs such as the vagina, cervix and uterus will be soften when you palpate while examination.
Another question I have is in regard to why the BMI or body mass index is important for the doctor. What can he tell from this?
Okay, when people have the higher BMI, that means she's obese. That woman obese, that means that she have a lot of fat. The fat normally can be converted to be the female hormone that can affect her period.
Okay, so we are now at the final stage where we have the differential diagnosis. The doctor is now going to give us 3 possibilities for a diagnosis. Tell me what they are and what further treatment or investigation or advice he wants to give to the patient.
Okay, from the patient history and my physical examination, I think it's mostly be the first pregnancy, and the second maybe we call the polycystic ovarian syndrome, and the third we should find out the other systemic disease such as the thyroid, that most common in generally. So I want to give check. I want to work up for this patient, and I send her to take the blood correction for the test hormone such that combine hormone is thyroid TSH, that means the thyroid stimulating hormone, and the prolactin. And the second I will send her for the urine pregnancy test, and the third I want to check to do the ultrasound for her.
So that is the final stage, and after getting the definite diagnosis, the doctor can then give the patient the appropriate medication or treatment and advice about their lifestyle.